The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Welcome to this evening's edition of Health Connections. We are downtown Rochester in front of the beautiful Mayo Clinic. Thank you for joining us this evening. Tonight we'll talk about the H1N1 virus and emergency preparedness. Tonight we will discuss the current situation regarding this novel influenza and some new findings as well. Stay tuned. Downtown Rochester with Dr. Greg Poland, Professor of Medicine and Infectious Disease. Thank you for joining us, Dr. Poland.
My pleasure.
Appreciate having you here. Tell us a little bit about what your feeling is on the H1N1 outbreak.
Well, you know, this started in late March, early April in Mexico. And actually, our military picked up the first 2 cases in the U.S. That's not well appreciated. And from that, we've now developed to a point where there are at least 3,000 known cases in 46 states and 22 countries. So we certainly do have an outbreak of a novel H1N1 influenza virus. I think what's important, though, is that this is a very mild illness, at least to date. That could change in the future, and there's a lot of monitoring going on. And the other thing that I think is different is that we have antivirals now that treat it if we get to it within that first 48 hours or so of symptoms developing.
So we shouldn't be so concerned at the severity of the illness, just the spread.
I think where there would be some concern about illness is in the extremes of age, so the very young. They typically don't have any immunity to these sorts of viruses. And then in people who have a hard time responding with antibody levels to infectious diseases, so people who are immunocompromised for any of a variety of reasons. Otherwise, for everyday people like you and I that are otherwise healthy, it causes a mild respiratory illness, in many cases not even severe enough that physicians would normally even think to test for influenza virus.
And do you feel like masks or other covering devices are effective in limiting the spread of this type of virus?
If it was here, yeah.
And you would probably wear one if it was here?
Yes.
Thank you very much.
Thank you.
And do you feel if we should have reported cases in our area, do you feel that masks would be an effective way to limit the spread of this sort of thing?
I believe that hand washing is number one. And don't touch your face. Keep hand washing is very vital. And as far as mask, it is a tool. It's a great tool. But like I said, number one is hand washing and staying home if you think you have the flu. Do not spread it. So I think that's the number one.
Let's say that next week or next month we have 10 reported cases in Rochester. Do you think that means that we should go out and buy masks and be very protective that way? Or how would you react?
Yeah, if in 1 week, if we went from 0 cases to 10 cases, then yes, I would wear a mask, even though I've been sneezing today because of allergies. Yeah, then I'd get a mask.
What if it was in 6 months' time? You know, in 6 months' time we had 10. If we just had 10 reported cases, regardless of the.
In 6 months' time?
Mm-hmm.
Well, that's what I think the real problem is. I think this swine flu is going to die out, and if it surfaces, it's probably going to die out for 6 to 12, 18 months, and then come back and be a major problem.
And then you might be concerned.
That's what happened in the last swine flu epidemic, or the real bad flu epidemic of 1918. Actually, it started in 1915 and 1916. If you look at the charts, they had a few thousand people who got it, and then it was dead for a year or two, and then it just took off in 1918.
Took everyone by surprise.
It took, yeah, it just swept real fast.
We've heard terms such as novel, pandemic, outbreak, imminent pandemic threat.
Yeah.
Currently, we are at phase 5.
We're
Is that
phase
correct?
5 of the WHO criteria, meaning that this is a novel virus, that it causes human infections, and that it's transmitted from human to human. So we meet all of those criteria. Phase 6 is the actual pandemic. That wouldn't be declared until there was sustained and widespread human-to-human transmission. Are we there or not? It's a little hard to tell because in some ways it's fascinating. We're watching this happen in real time. We've never been able to do that before. So we're literally watching it happen before our eyes. And I think if we begin to see greater severity of cases or much more transmission and spread, I think then it would be properly considered a pandemic.
And I think we in the Midwest, especially in Minnesota, feel far removed from the areas
Yeah.
that are affected now. And we feel like maybe we have a little bit of a buffer. Maybe we're in a safe zone. But almost inevitably it will reach us, I think.
I think
Is that true?
I think it's fair to say that that particular H1N1 influenza has caused infections in every state,
Okay.
even if we haven't detected them yet.
Okay.
I think the critical part, and people do tend to hook up the word pandemic with severe, and that would be an incorrect association. A pandemic just means that it's novel and widely spreading, but it doesn't imply a severe pandemic. Now, we've had a severe pandemic in 1918. It's thought that somewhere between 50 and 100 million people died as a result of that pandemic. And yet in 1968, about 40,000 Americans died. Well, that's how many die every year of influenza.
Oh.
So far we've had a handful or less of deaths due to this novel virus. So by all measures that we know to judge a virus, this is very mild.
Now, you work with research regarding vaccines.
Yes.
Have you worked with anything regarding the H1N virus or anything like it?
Yes, what we're doing actually is putting together a grant proposal to the government to actually study the genetic background to immune responses that occur. So we're interested in finding out, why do some people respond well to a vaccine against this virus and other people respond poorly? And we think that's important in terms of developing a good vaccine.
And why do some people respond? What's your thought?
Well, what we've been able to do is narrow down on a few key families of genes. For example, what are called the human leukocyte antigen genes and the cytokine genes. And so what we're trying to do, and it's very complex because each gene contributes a little bit. So we're trying to understand the whole pathway of genes that together influence and determine how you're going to respond. Similarly, this determines whether you're going to have a mild illness, a severe illness, or die as a result of it. So it holds a lot of implications.
And if you say you get the vaccine for this current H1N1 virus or strain, and 6 months from now the virus mutates and comes back in a different form, do you think that that would imply that you would have some resistance to the mutated form?
It really depends on what kind of mutation it is and where in the genetic structure the mutation is. But yes, generally speaking, if you've gotten a vaccine against a very closely related subtype, you usually have some cross protection. For example, the newest information is that older adults, and I'm talking now 50, 60 years old and above, because of the lifetime exposure they've had to viruses similar to this, and because they've had repeated influenza immunizations, they have at least a modest degree of cross protection against this virus. The younger you are, or the less number of vaccines that you've had, or the less number of influenza infections you've had, the less protected you are. And that's why I think we're seeing this infection primarily in children and young adults. The mean age across the U.S. is about 15.
Look for these symptoms. You might have a fever and a cough, a sore throat, or a runny or stuffy nose. If you think you have the H1N1 flu, stay at home or in your hotel room if traveling, except to seek medical care. Do not travel or go to work or school. Avoid close contact with others for 7 days after your symptoms begin, or until you have been symptom-free for 24 hours, whichever is longer. According to the CDC, everyone should cover your mouth and nose with a tissue when you cough or sneeze. Wash your hands often with soap and water, or use an alcohol-based hand gel. Avoid touching your eyes, nose, or mouth, and avoid contact with ill persons.
Now, you said people in their 50s and 60s. I know, for example, my parents, who would be in their late 50s, early 60s, that age group, they haven't been a big fan of the influenza virus, or vaccine, excuse me.
Yeah.
They haven't been the first in line to receive these vaccines every year. So can we assume that these vaccines are what's providing people in this age group that protection, or can we just assume that maybe the antibodies they've built up from exposure, like you had said, is the reason, or is it a mixture of both? Do we have any evidence saying that vaccines actually provide more resistance than just general?
It's a very good question, and I think it's both. The data that we have suggests, we've looked in the last 2 years of people who have gotten the vaccine, which contains an H1N1 component, by the way, not this particular type. And in those individuals where we know they got the vaccine, we're able to see, with age, some modest degree of protection or of cross-neutralization. So people have a variety of unfounded fears and misperceptions about influenza vaccine, but I'll tell you, it is a fantastic vaccine in terms of decreasing the morbidity and the mortality that occurs to it. And every once in a while, when novel subtypes like this pop up, there's always a lot of people that wish they had been getting them.
Right, and an interesting point you brought up that I guess I was unaware of is that not only is that vaccine protecting you this year, but it's protecting you through in the future.
Potentially into the future. Now, we do change the vaccine every year, and that reflects the fact that slightly different subtypes arise every year. But yes, it does offer at least some modest degree of protection.
Hi, Tammy.
Hi there.
So, I'd like to ask you a few questions about the H1N1 virus.
Sure.
On a scale of 1 to 5, being 1 not concerned at all, and 5 very concerned, how concerned are you that this will affect you and your family?
2.5, 3.
2.5? In the sense that it might not reach our area, or why would you be not so concerned about it?
I don't think it's actually going to reach all of us in our area.
Do you think a vaccine or another treatment will be in place by the time it would reach Minnesota?
Possibly. Yep.
Betty, I wanted to ask you a couple questions about how concerned you are about the H1N1 virus. On a scale of 1 to 5, 1 being not concerned at all and 5 being very concerned, how concerned are you that this will affect you and your family?
On the scale of 1 to 5, I'd probably say about a 4.
Okay.
I myself had the influenza virus after receiving the flu shot, and I was off work for almost 2 weeks, and it has affected me greatly, and I'm just concerned for my grandkids and my kids, of course.
I'll ask you a couple of questions about how concerned you are about the H1N1 virus. On a scale of 1 to 5, 1 being not concerned at all and 5 being very concerned, how concerned are you that this will affect your family or yourself and yourself?
1.
Not concerned at all?
I'm not concerned at all.
Can you tell us why?
Well, for one thing, we're in Rochester, Minnesota. We have the Mayo Clinic here with people like Greg Poland, Dr. Poland at the Mayo Clinic. He's way ahead of this game, and I just can't see that this problem will surface up here. I think there's a very good chance it could just die out on its own, as many swine flus do.
The key thing in terms of treating it is to get to the doctor within that first 48 hours, because it's treatable.
The symptoms are treatable.
Yeah, and the virus is treatable. It's sensitive to 2 different drugs at this point. So.
And those are?
Those are two drugs, one called oseltamivir and the other one called zanamivir, commonly known as Tamiflu and Relenza.
Yes, that's good. Okay, and how effective do you think masks are in inhibiting the spread of this?
Well, this is very interesting because I just got back from Washington, D.C., and there are a number of travelers from Asia and Japan that were coming to the mega mall here, and they were all wearing masks, which of course are not very effective. What the typical surgical mask that you see does is it prevents you from spreading virus to others by forming a barrier over your mouth so that when you cough or sneeze, it's less likely to get out into the general atmosphere. A special kind of mask called an N95 mask is a mask designed to prevent virus from getting into you. So they actually have two different...
So there's no protection? The general mask, I guess I was under the false impression that the general mask would provide some protection against saliva or
yeah, I think
respiratory, but not much.
It protects against what's called large droplets.
Sure.
And that's the typical way that influenza is spread. But the airborne type of virus, no, it wouldn't protect against that. But I think it has some other functions too. When you're wearing a mask, it tends to be a reminder not to put your fingers into your eyes, your nose, or your mouth, and that's how we inoculate ourselves other than breathing it in.
Sure. And if and when it reaches us, if and when we have a number of confirmed cases, would your response be that everyone should wear masks and of course wash your hands as we're doing now, but school closings, sporting events, what's your feeling on that? Is that how we should react here in the Midwest?
I don't think so.
Okay.
And my viewpoint might be a little different than others, but this is a very mild virus. So last year, 36,000 Americans died from seasonal influenza virus, and every year we have outbreaks. We don't close the schools,
right,
unless there are really high rates of absenteeism. So if the virus stayed as mild as it is right now, no, I don't think they're likely to be very effective. When you close the schools, guess what happens? All the kids go to the malls,
right? They get together
and that's just as bad, if not worse. So I don't think so. Now, if it were to change or mutate or become more severe, that's a different story.
But isn't it true that this is more transmissible than the general influenza? That's what I read, but I don't know.
There's work going on right now, and there's something called a basic reproductive rate that tells you something about transmissibility of the virus. And this is about what seasonal influenza virus is right now.
Okay, so maybe slightly more transmissible,
at
but
most.
not noteworthy. Okay. Well, thank you so much for
my
interviewing
pleasure.
with us today. You had a great degree of information that we appreciate.
Well, what happens in a pandemic situation is the virus changes a little bit to the point where we don't recognize it. It's a novel virus. And so what happens to a person is their immune system begins to have this rush. And while that's a good thing, in a way, it ends up being a bad thing in a pandemic, because what happens then is it floods sort of your body and your lungs with fluid, and you become very, very ill. And it tends to affect younger people more than older people, because why? Young people's immune systems are much healthier. Mm-hmm. And so that is the concern we have in a pandemic situation.
Okay. Pete, tell me a little bit about the symptoms that we might see and how to clearly separate them from just a traditional flu.
Well, I think, like Margene mentioned, it's important to know a little background on influenza in general. There's many, many hundreds of types of influenza viruses. The seasonal ones that we get right now are primarily a respiratory type of illness, where it's really that coughing, sneezing, achiness, fever, and that's why we encourage everyone to get their flu shots on a regular basis to prevent the seasonal flu from occurring. The avian flu is what's happening in parts of the world right now where people have very, very close contact with sick and dying birds that have the avian or bird type of flu. And so that's the situation where we currently don't see in North America, but it's being monitored very closely to see if it does get into our bird population. Then the third category, the issue of a pandemic, is what Margene mentioned, is that the concern is the longer this avian strain of influenza is out there, the more opportunity it has to genetically change its makeup to shift into something that, into a virus that's easily transmittable very easily from person to person, and where we would be in a situation where no one in the world has immunity to it. So that's the concern, where the symptoms to each may be varied depending on if it's the seasonal flu versus avian flu versus pandemic strain. But the big message is relative to currently the watching that's going on, monitoring to see that the longer this avian strain is out there, they're watching very closely to see if it changes its genetic makeup to be easily transmitted from person to person. So we're not there yet, but that's what's really being monitored closely.
What kind of questions, Karen, do families need to be asking right now as they make preparations for this? What are the what-ifs associated with this thing that just seems like a monster when you hear about it right off the bat?
Well, I think the first thing that people need to do is get educated. Knowledge is power, and they need to understand what we're trying to do and why it's so important. They need to go ahead and listen to public health and try and get as much information as possible. Then they also need to do general information like emergency preparedness as well. Some of pandemic flu preparedness is something that can be used in any emergency, such as stockpiling food and water. We can certainly use that during a blizzard, and we're at home as well. So it's real important first that people understand that it is important and to get themselves educated, but also to help with family preparedness as well.
There are some notions, and I'll open this up to anyone who might want to speak to it, but certainly our public health people have probably thought through this in great degree about the availability of solutions and how that gets administered and the process for making sure that if there are vaccines, who gets them and in what order. Because if pandemic flu happens as people suggest it could, I mean, we're having to look at businesses and which ones stay open and which ones don't. So how are we going to go about deciding those kinds of things in addition to vaccines and the availability and who gets access?
Well, I can start with that. I think that's a very important point that the general public know of some of the major challenges in pandemic planning. And the first one is right now there currently wouldn't be enough vaccine to go around because the current seasonal flu vaccine that is created every year is based upon projections of what they think the seasonal flu virus will be. Until the genetic change actually occurs to lead to a pandemic strain, that's really when they'd truly be able to start identifying which strain to develop a vaccine for, and then be able to go through a manufacturing process where currently it takes 6 to 8 months to do. So I think it's very important for the public to understand that where we're at as a world right now, not just a country or even a state, that worldwide the challenges with not having vaccine readily available is probably one of the biggest ones. But then as a pandemic would unfold, and I think that's where the other message is that it's not a matter of if, it's when. Worldwide, people are saying it may not be this particular H5N1 avian strain that's out there that would lead to a pandemic, but it may be 5 years, 10 years down the road where some other strain emerges, but it's a matter of when that it will happen at some point. But other challenges as a pandemic unfolds deals with a whole surge of patients. A pandemic typically estimates would have happened through a wave of disease going through a community, through a state that could last 6 to 8, maybe 12 weeks long. And that surge of people who would be sick and potentially needing to be hospitalized would really be a major, major stress to the healthcare community. So those are the other challenges that I think we need to be aware of and the general public needs to be aware of.
What are we saying to people as a whole? Is it better, should we hear about this, to just stay in our homes and be isolated from potentially acquiring the disease, or?
Well, when you recognize that we really are going to be on our own for quite some time before and if there is a vaccine developed, there are some things that we can do ourselves to reduce the risk of any kind of viral spread. Outside of proper hand washing, of course, would be number one. But then, the isolation and issues of going home, or snow days where we're going to actually, the governor might declare a snow day where people go home for a couple of weeks. That might be another scenario that occurs. Anything that we can do to reduce the spread of the virus, similarly to the kinds of viruses that circulate now, those kinds of common sense things we can employ as individuals during a pandemic flu situation as well as we can today.
And I'd categorize it in 3 different areas: the community preparation, the planning that's happening among government agencies. Next area of preparation that deals with businesses and organizations, their preparations, and a lot of that's called continuity of operations. How will they make sure that they have key systems in place, key backups for key employees? And then the foundation of all that is really that individual and family preparedness, because without individuals being prepared, it's hard to have any organizations prepared. So that's kind of the triangle or pyramid of the overall broad preparedness that we've been doing.
I think Minnesota is extremely fortunate because the Minnesota Department of Health, along with our emergency management system, really took a frontal road in trying to provide us with a plan that would work, and it addressed business continuity plans for small businesses, large businesses. It addressed what public health roles were going to be and how all of us were going to mesh together. Then you bring in National Incident Management Systems, or the NIMS or MINIMS, that speaks to who's going to be the incident command should something like this happen. And it comes, to me, it comes from the state and comes down to the rest of us. And as a business, we look to our county public health to give us direction for that. One of the things that we have done with our continuity plans is to determine what are our essential functions. And as utilities, our essential function during a pandemic is not to go out and build new utility developments or things like that. It's to keep the power on so that people who are at home and are ill have resources that they can take care of themselves. They've got clean water, they've got fresh fruit, food, they've got electricity to keep them warm or gas to keep them warm. They have those services essential to them. And in a business structure, we decided then to take it one step further and create who were our essential employees. In other words, I'm a compliance and training coordinator. I am not an essential employee. I can't go out and switch an electric line or do a gas hookup or something like that. Those are our essential employees. Those people then needed to be put on kind of a priority list.
Thank you for joining us for this evening's edition of Health Connections. For more information on this topic, you could go to the Mayo Clinic website at mayoclinic.com or the World Health Organization, www.who.int, or the Center for Disease Control Agency, cdc.gov. Thanks for joining us. We'll see you again.